Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, following Ivers-Levis esophagectomy, now the next type of esophagectomy is actually McCune esophagectomy. Right. In the McCune esophagectomy, this is actually here you do in this McCune esophagectomy. Okay. First, you will do a right-sided thoracotomy is done. You will do a right-sided thoracotomy followed by a midline laparotomy is done and followed by a neck incision is done in McCune esophagectomy. So McCune esophagectomy, you do 2 incisions. So it is a 3 incision surgery where you do a right-sided thoracotomy which is followed by a midline laparotomy which is again followed by a cervical incision is given to the patient. Okay, then you will do the esophagectomy completely. It is removed, that is en bloc esophagectomy is done. Follow this because complete esophagus is removed and you are using 3 incisions, so it is associated with maximum mortality and morbidity among all the types of esophagectomies.
thank you and thank you for watching.